So now we're going to talk about the probe. Let's see, I'm trying to get that to where it's called. Okay, so with the probe, when I talk about this with clients, I typically explain it like it's a little mini ruler. And so I'll usually talk to them while I'm probing so that I'm giving them information and oral health education as I go. And so I explain it's a little ruler. I use it to measure in between the tooth and the gingival margin. What I'm looking for, healthy ranges are, 0 to 3 millimeters, that little space in there. But once we start getting to 4 millimeters, then we start thinking there's inflammation, gingivitis, things going on, possible periodontitis. And then 5 and above, we definitely have bone loss and problems. So I explain that to him as we go. The sequence is pretty similar to the Explorer. You're going to use a fulcrum. I've got the mouth moved back, the gingiva, so that you can see better, but usually you would be retracting with that non-dominant hand. I'm going to start on a molar for this one. You also use an up and down walking stroke here. You're going to start on the distal line angle and go up and down, and you're going to walk into that distal. And so what you do, it doesn't stay straight up and down. We've got a round tooth and a spot interproximal to get into. We don't want to get stuck like right here on the contact. Our probing readings will be inaccurate. So as you go up and down, you lift up and angle in just a little bit so that you can get underneath that contact and get the appropriate reading. You're going to take 6 readings per tooth, 3 on each side. So there's going to be a distal, a direct, and a mesial reading. And what you're going to do is you're going to pick the highest one in each area. While you're practicing with these are periodontal typodonts, and so they've got tons of bone loss. For now, only go 3 or 4 millimeters in so that we can get the motion correct. So then when you call these off, you go through, you get your 3 readings of the 3 highest spots in each area. And then whether you're charting for yourself or if you're calling these out to somebody who's charting for you, you call it out all together. So you would say something like 3, 2, 3, rather than kind of having them all merge where you're like 3, 2, 3, 3, 2. Like it's kind of hard to know what tooth the person is on. So you want to call it as a group, 3, 2, 3, 3, 2, 3, 2, 2, 2, like that. So I'm going to start in the back, start on that distal line angle, and you want to make sure that you're going up and down. Come back to the distal line angle, go across the direct, and then into the mesial. And so then what I'm going to suggest you do, because we don't just take probing depths and probing readings, we also check for bleeding, because that's going to show us whether or not the person is in active disease or not. And then we also look for recession, or areas that the gum tissue or gingiva has moved back or receded from the tooth. So I would suggest you probe a sextant. Probe the sextant, and then once you're done with all of those readings and they're marked, pull the cheek back and look for any bleeding spots. And you're going to call those off similar to where the probing readings are, like bleeding, mesial buccal of number 3, bleeding spot, distal buccal of number 5. And then you look for recession, and you have to be specific about this too. For recession, you're going to call it off like it is too. So, for example, you could have 3 millimeters of recession on the distal, 2 millimeters on the direct, and then none on the mesial surface. And so you would be very specific about how you call that off. So you want to make sure that you get all of those things. As far as mobility is concerned, I will check for mobility as I go. Like as I'm going around and as I'm fulcruming on the teeth, I'm checking to make sure that they're stable in there. And then there are definitely times where I'll notice more mobility just as I've started treating, and I'll go back in and add it. Another thing you look for once you're done are furcations. We'll talk about that more in depth next spring, but furcations just mean that there is more bone loss in that area, and you can get your probe down into the spot. Like if these are your roots, you can feel down in between the roots with your probe. And so there are different levels of furcations, but we're going to find those too. The main thing you've got to get down is that you're covering all surfaces of the tooth, angling into the contact or tipping that bend away from the tooth, and going up and down the whole way.